Hello, my name is Madison Sheriff, and in this video I will be discussing ethical issues and implications in research surrounding communication. According to an article by Paprika Academy, communication with science produces supports for research and studies and also helps to notify decision making. Communication specifically within science is crucial for addressing scientific misinformation. It's the practice of updating, educating and hovering awareness of science-related topics and increasing the intelligence about scientific discoveries and arguments. Some key points are to recount the story, individualize the message, speak with people instead of to people, and make sure to be human about it, or in other words, keep legitimate and straightforward communications and conversations with the general population instead of mundane scientific lingo. Within healthcare, providers are faced with ethical dilemmas fairly often. In regard to research on human subjects, some of the most common ethical considerations are stated by Pritha Bhandari to be voluntary participation, where a participant can opt in or out of the study at any time, informed consent, which is where the participants know and understand the purpose, benefits, risks, and funding behind the study prior to them agreeing or declining, anonymity, which is where you do not know the identities of the participants and personal data is not collected. Confidentiality, which is where you know who the participants are, but nobody else is aware of this information. However, personally identifiable data is anonymized, so it cannot be linked to other data by anyone else. The potential for harm, which is any physical, social, or psychological harm to a participant that is kept to an absolute minimum. And lastly, results communication, which ensures that the work is free of plagiarism or research misconduct, and results are accurately represented. Some forms of ethical issues surrounding communication in healthcare can present as a physician not wanting to tell the whole truth or maybe downplaying a serious diagnosis. It might even look like a physician withholding certain information from a person with a cognitive impairment in order to prevent them from becoming upset or hyperfixated. Despite the goodness and thought behind such an action, communication is supposed to respect the autonomy of individuals and should adhere to the principles of beneficence, non-malfeasance, and justice. Respect for cultural differences and beliefs should also occur. In a study published by Elsevier, the idea of compassionate deception is discussed as a way to conceptually illustrate the fine balance between using lies and deception while acting simultaneously with recognition and care toward dementia patients. I found this to be interesting because the article talks about how healthcare professionals can feel the pressure about remaining truthful and honest regarding a patient's healthcare, but yet, with a dementia patient, they've argued that lies and deceptive practices can be more of a respectful, meaningful, and necessary way to care for them. If I, as a healthcare professional, needed to communicate effectively and appropriately with patients, families, and healthcare providers within my scope, I would be direct yet respectful. I would be sure to carefully choose my words without creating any deception regarding the situation at hand. Prior to speaking with my patient and their family, I might look into their cultural background to see how I might best present the information. I might also look at their intellectual abilities and ensure that what I'm saying is something that they could understand. I'd also probably employ the teach-back method or ask them to restate what I've told them to make sure that they understood what I said. Within my scope as a registered nurse in Michigan, I'm able to educate patients and their families to help manage their health, as well as to help them make informed decisions. If I were to write formal correspondence to communicate information and ideas, I would first write out what it is I'm trying to convey, and then I would look it over closely for any grammatical or spelling errors. I then would have my correspondence peer-reviewed by another healthcare professional or a coworker to see if any changes need to be made. I would also be sure that I was familiar with the proper chain of command before sending out this correspondence. I think that through formal correspondence, great things can be achieved and improved, but a lot of it has to do with how the ideas or information are presented. As nurses, it is important that we advocate for change and look for ways to improve practices for our patients and our coworkers, and one way to do that is through formal correspondence to our leaders. Thank you.